Hello friends, greetings of the day and warm Diwali wishes to you and your family. As you know, festival of eating sweets is around, but you may be resisting yourself because of fear of cavities. Dear friends, don't refrain yourself or your small kids from eating sweets and chocolates in this festive season just because of the myth that they'll develop cavities. Let me clear one thing, that cavities does not occur in just a single day. Today, I, Dr. Gaurav Gupta, your dentist and friend, will be discussing about the dental cavities. What is a cavity? Cavity is basically a permanent and irreversible damage in the hard surface of your tooth that looks like a small opening or a tiny hole. And how does it forms? There is a thing called plaque, which is a naturally occurring matrix of minerals and bacteria that forms on the surface of your tooth. And as the plaques build up gradually, the bacteria keeps on accumulating on it. These bacteria eat the starches and sugar present in your food and creates an acidic byproduct. This acid softens the enamel, causing erosion, dental sensitivity, and allow the bacteria to invade and cause the cavities. If timely care is not taken and the tooth is left untreated, these harmful bacteria keep on invading the enamel and the decay can penetrate deep inside the canals, which can result in need of root canal therapy and sometimes maybe tooth removal. How do we diagnose the cavity? During checkup, your dentist examines each and every surface of your tooth very closely. If anything looks abnormal or the cavity seems to be very deep, then he takes an X-ray and the treatment is prescribed according to your need. What are the symptoms of tooth decay and cavities? In early tooth decay, there are usually no symptoms at all. No pain, no discomfort, no sensitivity, except for some black and brown spots on the surface of the tooth. And it's very difficult for you to judge whether it's a stain or a cavity. As the tooth decay gets worse, it can reveal some symptoms, and those symptoms could be severe toothache and discomfort, sensitivity to sweets, hot and cold, a cavity or a hole where the food gets stuck, and sometimes maybe infection which can lead to pus formation and which can cause severe pain, swelling and sometimes fever also. What are the possible treatments for tooth decay and cavities? The treatment for tooth decay and cavities depend on how deep the cavity is and how big the problem is. Sometimes it can be cured with just fluoride treatment. Fluoride treatment can be done when the tooth decay is at very early stage and it can help the enamel to repair itself. Another treatment could be tooth filling. If you have typical cavity, there's a frank hole in your tooth where the food gets stuck, then your dentist can remove the decayed tooth tissue and restore the tooth with a filling material. Another treatment could be root canal. It is generally required if the damage to the tooth reaches to the roots and canals and the infection spreads to the pulp, which is the vital part of the tooth, and there is a pain and discomfort. In worst case scenario, tooth removal might be the choice of treatment. These are the situations where the damage to the pulp cannot be fixed with any kind of treatment. Then you will need a bridge or implant to replace the missing tooth. In a nutshell, you should understand that the tooth cavity doesn't start in a day. Also, it doesn't progress and spread to the roots in just couple of days or couple of weeks. In fact, it takes reasonably good time to harm your tooth and making the decay troublesome for you. You get sufficient time to fix the problem and prevent yourself from more invasive treatment. So my dear friends, eat lots of sweets and cookies. Celebrate this festival of lights to the fullest and don't worry about your teeth, we'll take care of them. Once again, I wish you all a very, very happy Diwali. Have a happy and safe Diwali. Thanks a lot for listening to me.